Dr. Johnston's phrase of moral distress finally gave nurses a word to describe this apparently all too common feeling. In the 4 decades since he first wrote about it, the literature on moral distress has exploded, not just in the field of nursing, but for doctors, therapists, chaplains, and even beyond the medical field. How many of us have known a situation where we were clear on the right thing to do, but felt constrained to act? Dr. Johnston also talks about the lingering effects of these situations, what he calls reactive distress, but what in later literature has come to be called moral residue. This is the moral gunk that clings to us, that we carry with us after facing these impossible situations, and which over time can build up and muck up our engines. Researchers have identified 3 potential consequences of the moral residue that builds up over repeated instances of moral distress. First is ethical numbing, where healthcare providers become indifferent to or begin to avoid difficult ethical situations. The second is conscientious objection, where providers might more forcefully push back against the policy they feel is unjust. Sometimes conscientious objection can be productive, but other times it can be damaging to the provider or even to the patient. And the third impact of moral distress and residue is burnout. Several studies have shown that nurses have considered leaving their position or even their profession because of the experience of moral distress.